Good morning from Southern California. This is Dr. Tom Peters. I started Dr. Tom Peters Consulting, which is a not-for-profit organization to help people who work attain organizational goals. And when I say work, I don't mean laborers. Everybody works. You know, Queen Elizabeth works, Elon Musk works. So the organization, my organization's goal is to help everybody be aligned with the activities that lead to organizational goals. I'm a research psychologist and I practice mental health for many years. One of the organizational goals in mental health is to help the client recover from mental illness and symptom reduction, of course. If you work in a private practice setting and you have other therapists working for you, or even if you just have one secretary, if they have contact with your clients, that can influence the outcome of the therapy. This is research and evidence-based information. I wrote about it plenty in my dissertation, which is available on ProQuest. But that's not going to be part of this presentation. I designed an occupational program to help those who suffer from severe mental illness or chronic mental illness recover from the mental illness, and I want to make this program available for those individuals who need it in order to help therapy, medication therapy, psychotherapy work better. Now I'm going to break down the presentation into 3 parts because it could be too long, so 3 5-minute videos. Let me start with the statement of the problem, and then I will explain how the program will help those who are referred to the program, which could be self-referral or referred by a therapist or psychiatrist. So my name is Dr. Tom Peters. As I said, I was the CEO of my company. The statement of the problem is as follows: inadequate quality of services in mental health, which means that this is a worldwide phenomenon. People do not recover at the rate we expect them to recover. Some people never recover. Some people commit suicide. Consistently high rates of suicide, consistently high levels of social, relational, and occupational problems related to mental illness. Research-based treatment modalities seldom utilize occupational activities. But occupational therapy itself is available at facilities that provide services to veterans or those who are severely, chronically, mentally ill. But occupational activities to help those who have the capacity to do some work, but a decreased capacity, to improve that capacity that hasn't been attempted. And this program requires some ability to perform in the capacity that the program offers, meaning there are some jobs or volunteer work that will be available, and at some level everybody has to be able to perform there. Now, the long-term benefits of work and work characteristics have not been identified by research. We know that any occupational activity, any kind of occupational therapy can decrease symptoms for 6 months, but it's not known by science if the benefits are long-term. Now, I tried the program I'm advocating here myself, and I did it for well over a year, and it worked for me. So I will talk about it in the second video. The purpose of the occupational program: increase psychotherapy and medication therapy effectiveness, provide empirical research data to identify work characteristics that lead to long-term benefits. So this is a research organization too. So whoever participates will be asked if we could use information about them performing in the work group for the benefit of science. Identify multicultural factors that influence the effectiveness of occupational programs, which is does the same program work as well for women, work the same way for women as it works for men, or there are differences? Maybe some activities might be better for Hispanic clients, other activities might be better for more beneficial for Caucasian clients. We don't know yet. We don't have that information. That's why we need to research. Problem with existing techniques. Behavioral goals are required in recovery, but behavior modification alone is not effective to treat depression. So to treat depression with behavior modification, do this, or maybe you should do something else, that doesn't work. Cognitive behavior therapy works, but the therapist does not have any control over the behavior activity of the client. Whatever they are required to do in the community, socialize more, go to church, it's simply out of the therapist's control. And this program that I'm offering offers a new experience to clients. Volunteering is always recommended. Now I'm going to end the video here, and I'm going to start with the second part.